From gobbler to glam. That's what we're going to talk about today. Welcome back to the channel with me, your host, Dr. Debra Durst, and my co-host.
Hey guys, Faraday Goli, family nurse practitioner here at Revitalize MD. And today we're going to talk about turkey neck. What is it? Who gets it? How you fix it? Why it happens? All the things. So the turkey neck is poor jawline, essentially loss of elasticity, collagen, and bone structure in the face, and everything starts to sag. You get jowling, you get the skin that wobbles back and forth, just that laxity, and it all just kind of hangs, and you get that gobbler that nobody wants.
Yeah.
The dreaded gobbler.
Yeah, and almost everyone at some point is like, what is happening under here?
Why is this here?
Like, what is happening? And so, of course, we, do a lot of wellness and sexual wellness, and that's our passion, and we love that. But we do a lot of aesthetics because it ties hand in hand, because we notice things as we get older, and it's not just related to inside and how we feel, but we start to notice things, and we have a passion for helping people look younger naturally.
When we feel our best, we should look our best.
Yeah. And we want to stimulate or give back the body what it needs. So the aesthetic approach is still the same as everything else we do. And so what's happening under here is a loss of collagen elastin, number one, so that your skin, just isn't as tight as it once was because of that collagen elastin loss.
Loss of fat pads in the face, loss of bone structure as we age. So our bones keep everything up and nice and help keep that skin nice and tight.
Everything's tacked around.
Everything's tacked up, right?
Yeah.
Tacked up. So when we have that loss over time, whether it's lack of hormones, aging, extreme weight loss, whatever it may be that's causing those things to occur, the skin starts to become lax and hang. And then we see that jowling.
Yeah. And I think it's like a combination of like everything. So if you look in the mirror, you're seeing skin changes. That's a collagen loss. So you need to stimulate collagen. And like you said, there's some bony resorption and loss with age. And so hormones help minimize that, but there's still changes that happen. And then the fat pads in the upper face tend to get smaller or heavier, and things sink down just like gravity, you would think. And so
pulls us all down eventually.
So we have higher, like bigger fat pads, like in that nasolabial fold here with jowling. And then along the jawline, you just have fat that's coming down. And so, it's all a combination of things, but what can we do about it? So, and it's the holidays. So we thought we'd hit it, and we always run, some special treatments around the holidays and do a turkey neck treatment. So we thought we'd hit this with a podcast. So what we tend to do is combination aesthetics. And so we like to get the body back what it needs to look better, but naturally. And so whatever's happening, we're going to try and reverse that and get the body back what it needs. So you need to do something that stimulates collagen and tightens as well. And so a lot of times we're pairing either injectables with lasers with that, or lasers and potentially threads for that lifting.
Yes.
And so it's a great way
or
to
all
define
of it.
the jaw, or all of it.
Sometimes we need a little more help.
Yeah. Well, and the nice thing about it, these are non-surgical approaches. And so if you can give the body back what it needs, and you can do stimulation, if we're looking in the mirror as we get older and we're noticing some changes in our skin, we're losing 1% of collagen a year. And, there's some studies that were like 7% in 10 years or in a decade, but about the same, amount. And so you want to do something to stimulate collagen elastin. So the two ways that you're going to do that is with lasers, where you're injuring or heating or telling the tissue it's injured to stimulate collagen elastin, and an injectable that might do a blood product or a PRP, PRF, where you're using platelets to do that. So you want to use an injectable such as like a PRF, PRP, platelet stimulating collagen elastin, and a bio-stimulatory filler such as Radiesse. Sculptra is the other one, but I prefer Radiesse for multiple reasons, and we've done other videos on that, because you're spreading it and stimulating collagen elastin. And those two in combination work really well for tightening the skin and lifting.
But ideally, so for me, I'm doing this stuff now to prevent it later. So a lot of the stuff you can do pretty early on. I'm doing lasers along the jawline. Some of the injectables is needed, but really trying to prevent. So when people are like, well, why? I'm too young to need all of this. We're really not, because as we age, we know we're going to lose that elastin. We know we're going to lose that collagen. So if we can prevent that sagging, my goal is to not need a facelift.
Yeah.
That's what I want to prevent. I want to prevent needing a surgical facelift. So if I can do prevention through lasers, through biostimulatory products, now in hopefully to prevent, that is the long-term goal.
It is absolutely the long-term goal. And I honestly think that that can be done. So at the age of 50 in the past, we used to do facelifts. And again, without pointing out, like, she's like, I'm at an age where I'm not. And so,
And there's not that much difference, but right now I just had to give that a little slide.
Yes, exactly. She's like, I'm still just
I'm not there
preventing.
yet.
She's treating. No, but that's
I'm
okay.
not 50
So
yet.
the whole point is that if you're committing, I think about aesthetics the same way I think about nutrition and fitness. We go to the gym multiple times a week. You know, you can't go to the gym one time, lift, and think that you're in shape. I mean, I've seen people like, oh, I look good now after the gym one time, but you have to go on a regular basis.
It's like the
and
guys
commit.
that go and like lift
Yeah.
and they're in the mirror doing like
Oh,
all
yeah,
of their
yeah.
poses.
No, my
after
son does
one
that
big
too all the time, and it's like he's turning sideways. You can't see a difference yet, but he can see a difference.
Yes.
But that is, and so same thing for women for hair. We do our hair on a regular basis. We do our nails on a regular basis. We can't eat healthy just one time and be healthy. So the same thing with aesthetics. There's no one and done. There's no magical overnight, no pain, no downtime. And you have to commit to regular treatments if you really want that preventative, which is what you're
Yes.
doing right now, is like doing
That's the goal.
regular committed treatments to stimulate collagen and elastin. What we do in here, so I would say that this is a big area. I say for men, it's hair, eyes, and performance, obviously, and jawline. That they'll notice just a loss of definition of the jawline as well. Women too.
We see more of the, what is this?
Probably, yeah, or jowling.
The jowling and the little pouch that starts to form. I feel like that's where women are like, what is happening?
Yeah.
Men, it's that jawline.
Yeah, the jawline
What's happened
is not
to my
as,
definition?
It's kind of the same, but like a different. Like, I think women, it's like, it's not as defined here or it's not as defined here. And we are the hardest on ourselves and we'll pick out everything. And for men, it's kind of overall like the jawline becomes less defined. And so the ways that you would treat that, obviously, if we're tightening in here and we have any fat that needs to be reduced, those fat pads, that heavy, like the fat in the face is sinking down, then you want to do a treatment that stimulates or that kills fat and tightens skin at the same time. And so we have multiple treatments that do that, but you would never want to do a treatment that doesn't tighten the skin if you're killing fat. And if you have a loss of definition here, a lot of times we want to reduce the fat and stimulate the skin tightening or collagen. But you got to be cautious with that on who you go to, because sometimes you can kill fat in the face that isn't wanted. So you just have to be assessed first for that. And then obviously there are other things for women, like you can see these bands will pull down on things in the jowling area. So even Botox in that area will help.
Absolutely.
And then injectables, either a biostimulatory that you're spreading to stimulate collagen and elastin, but you can do a really nice jawline defining and contouring with filler that is deep to the muscle and on top of the bone and contours and can give, the guys their jawline back.
And even women.
Yeah.
We lose too.
Yeah.
Sometimes we need a little bit of definition.
Yeah. And we'll put some pictures up for you guys to look at, some pre and post pictures of the jawline and just what laser in combination with some filler injectable in the right location. So filler should be on bone, contouring the face. And so that is what you would want in that area if you're going to do it. And then threads are one that we didn't talk much about, but it's a great way to, a thread is basically a like it's almost like a fishing wire, kind of
It's
like
just
if you were
ground
to picture.
sutures
Yeah. Well, this isn't even ground. They're just like barbed.
or
And
barbed
so
ones. Yeah.
the Sculptra is the ground. But when you're doing the barbed, it actually pulls up on the tissue and it doesn't impede movement. So you put a thread. It's a
Cannula.
PDO thread. They first started way back with surgeries.
Hmm.
So they would notice that they did a surgery and where they had the sutures, the skin would look amazing on top of it. And so those PDO threads, and there's other types of threads too, but my favorite is a PDO. And you can either do the smooth for collagen stimulation under here, or you can do a lifting thread that just better defines the jawline and it doesn't impede movement, stimulates collagen elastin,
You
gets
can't see it under
better
the
with time.
skin.
It's a in-office
Yeah.
procedure that you essentially can go out and nobody knows. It doesn't impede movement, and those are amazing. But the goal is really prevention and combination treatments
Yeah.
after assessment,
So
essentially.
topically, we all need great skincare. That's
Mhm.
necessary. That's what we start with. We all need to be wearing sunscreen, medical grade sunscreen, good
Mhm.
sunscreen. That is not going to make things worse for our face. I really like the Elta MD brand. I'm not sure. Is that the one that you're using as well now? I believe so.
Yeah.
So we're doing sunscreen creams with peptides, growth hormones, estrogen sometimes if needed, depending. We have a great
Mhm.
compound cream in our office that we use, the RMD cream, which is phenomenal to help with crepey skin, loose skin, dry skin, just kind of help with youthfulness. So we start topically with that.
Yeah.
Then you've got
Gotta do the
lasers.
skincare. Yeah, you gotta have medical grade skincare.
Yep, got
I
to.
agree.
And then you go to lasers.
Mhm.
And then we go to injectables and then threads,
Yeah.
which kind of fall under that. So it's multifaceted. It's not, oh, I'm going to get on a medical grade skincare and my face is going to look amazing and be tight and my jowl and my turkey neck's going to go away. No, but when you're doing all these other things, you want to prevent going backwards. So it just helps maintain.
Yeah. And I constantly over and over again and again, I think we've done a disservice from the aesthetic standpoint. But we get it when it comes to fitness, nutrition,
Yes.
hair, nails, like just maintenance. But there's no one and done in life. And I continue to say no one and done in life. There is very like limited technologies or procedures you can really do with lots of different brand names. And so you can get, Google's a rabbit hole. But I
Yes.
think that you basically want to do combination and you definitely want to hit some medical grade skincare. And there just isn't a one and done in life that has no pain, no downtime. You magically look different right after and you're
Right.
done. You never have to do it again. So
There's always maintenance.
yeah, always
And
maintenance.
sunscreen. Sunscreen is the easiest thing we can do on a daily
Mhm,
basis
mhm.
just to help protect our skin.
And to help protect your collagen stimulation,
Yes.
which is already lost over time. And so, again, we've done other videos, even recently on like a lot of medical grade skincare. There's a new product from SkinCeuticals that I love, the Ultra Serum, the AGE, because it actually does help stimulate collagen, elastin, and some firmness. So
Doesn't want
using
that.
that in combination with those procedures is great. And
Yeah.
yeah, and then Elta is obviously good. And then the RMD cream, why it's good is because it has lots of different ingredients, but peptides topically, and it has a peptide in it. So that's going to stimulate blood flow and collagen and tightening and firming. And so, again, that's how you would get rid of your turkey neck. And obviously, the holidays come up and
Yes.
people are less active, maybe because it gets colder in most areas and people are eating a little more unhealthily.
True.
And so we thought we would just, maybe just plant the seed to like keep an eye on this during the holidays when you're
And we have a special
eating
going
in.
on if you're local.
Yeah, which tightens up in
Yes.
this area, which is great. And it tightens skin and kills fat if it's necessary in that area. And then we combine it with threads, which is great. So,
Yeah. I think the only caution that kind of Dr. Durst touched on earlier is not all lasers are created equal. And there are lasers like Morpheus 8, which are fantastic if you need them to really debulk and tighten at the same time. You never want to just debulk by itself because you're just going to increase the laxity in your skin and what's hanging. You always want to tighten when we're killing fat.
Yeah.
And then there are, so Morpheus 8 is great when necessary, or the Photona laser is another one that does
4D.
fantastic.
Mhm.
So not all lasers are created equal. So when you're going online and you're looking up these treatments, keep that in mind. You really want someone that has options. We have, Dr. Durst is the laser lady. I mean, we have so many lasers in our office. So we're not selling a specific laser because that's the only laser we have. We're selling a laser that's best for what you need.
Yeah.
I think that's really important when you're looking at, well, what treatment do I do? What's best for me? How do I combine this? So taking something like that and then adding like a hyperdilute Radiesse or the threads.
Yeah,
It's
combination.
fantastic.
Combination is absolutely the way to go about it. And again, I love wellness and sexual wellness. Sexual wellness is like absolutely, my jam for sure. Like,
Mhm.
love that. But because I am not just in a preventative phase and as I'm going through stuff, I became very passionate. I'm already passionate about learning. So as you learn things and tying them together that
Yeah.
help give the body back so that it's natural and you can potentially prevent, having surgical options
Mhm.
after was kind of my goal. And there's just amazing treatments out there, but you have to find an office that you trust.
Yeah.
And it's really a combination. And just know there's not a one and done. You will have to repeat. Usually, if you're
Yes.
trying to correct something, I say there's a series of 3 of whatever that is, and it's a
To
more
6,
intense.
depending
Yeah,
on
3
what
to
we're
6,
trying to
yeah.
correct and how bad it is.
And which laser treatment it is too, because some are more intense than
Mhm.
others. And so it depends. But you have to find an office that you trust so that they can find out what kind of results you're wanting to
Yes.
have and find the treatment that's right for you because it's different for everyone.
Yeah.
And so, but it is combination and it will require more than just the one. And I just had somebody on Friday that asked me, and it was a great opportunity, because I had a couple staff with me in the patient. And again, we do a lot of guy injectables, and it was a guy, and he said, "Am I gonna have to repeat this?" And I just started smiling, and I
Just
said,
kind of giggle a
"There's
little
no one
bit.
and done in life. Nothing, not even breaks. Like nothing is
Your
one and
oil
done.
needs to be
Yeah,
changed every so many miles.
yeah.
You need your
Your
filler replaced every so many
your yard needs
months.
to be cut more. You need to get your nails done on a
Yeah.
regular basis. Your hair, you're working out at the gym. There's just really nothing that's one and done in life. So just
Yeah.
know that you'll commit to it, but it is a transformation that's well worth the
Yeah.
commitment. So
Goal is to lift, tighten, and smooth. And if you can do that without surgery, that's great. However, some people do need surgery. Also, finding an office that'll say, we can do all of this, but you need surgery. Sometimes a facelift is necessary if we've gone too far and we're too far out where we can't correct it.
If you have excess tissue
Yeah.
and it needs tightened, for sure, there's surgical outcome. What tends to happen is the patients that aren't looking for that, or at least aren't looking for that yet, are the ones that are in front of
Yeah.
us. And so we're doing what we can to help you obtain the goal of not having surgery if that's your desire, or at least
Absolutely.
prolonging it. So, all right. Well, hopefully that helps. It's a fun one because from gobbler to glam, you want to tighten.
Yes.
That jawline, and these are the multiple ways of doing it. So if you have anything else that you want to comment, a treatment you've had done, any questions, definitely drop them in the comments and let us know, because we'll start conversations there. And we are willing to deep dive into anything wellness, sexual wellness, and obviously aesthetics too, because it is something that we do.
Yeah.
So let us know. Thank
Thank
you.
you.